Dr. Vito Cirgliano with LeBauer Gastroenterology is back answering our questions when it comes to colon cancer. All right, one of the things that people talk about all the time are all those commercials that we see about stool testing versus the colonoscopy. So is it the same? Is it different?
Yeah, that's a great question, because there's definitely been increasing awareness about the commercially available products of stool testing. Specifically, there's a lot of commercials about Cologuard, and these non-invasive tests have really come a long way of increasing the sensitivity for picking up on colon cancers and also sometimes colon polyps. That Cologuard, that'll detect colon cancer in 92% of patients and advanced polyps in 42%. Which unfortunately means that it misses colon cancer in 8%, or it misses those large polyps of 58%. And you converse that with colonoscopy, that'll pick up on those large polyps greater than 95% of the time. But we also can find them and remove those polyps, which again reduces those risks of progression to colon cancer. Another worry or concern I get from patients is, well, gosh, they get a positive one of those stool tests, and now there's a lot of worry that goes along with that while they wait to get their colonoscopy done, and there could be these false positives in 12% or so of patients, meaning it was positive and there wasn't anything there to have caused alarm, but certainly it caused a lot of worry.
Yeah, whereas the colonoscopy is kind of one and done, because they get to see everything and can take care of some of those polyps instead of you having to wait for another procedure at another time. Okay. All right, so let's just get to it. We hear the prep is terrible. We hear the horror stories. So how can you make that better for us?
Yep, you can't get around it, right? There's the prep is absolutely the most dreaded part of colonoscopy. With that said, though, the days of drinking the large gallons of prep are gone, thankfully. We now have low volume preps, which are just they can be as little as 6 ounces of prep, which then you drink with a bunch of your own fluids, whether that's Gatorade, Pedialyte, water, whatever the case may be. We can now flavor preps at home. You can add some flavoring to it, so it's not as terrible. And there's actually even some tablet preparation formulas now. So yes, that is still the most dreaded part, but it has absolutely come a long way.
Thank goodness. We do like to hear that it's come a long way. All right. And we can ask for those smaller prep times.
Yes.
Okay.
Yes.
All right, so colonoscopies, some folks are worried that they can be dangerous. Can you explain where they're getting that idea and what we should be thinking of?
Yeah, I mean, colonoscopy is a procedure, and every procedure carries risks to it. The biggest that we think about is perforation. That's putting a small hole in the colon wall. But thankfully, it's actually quite rare. It's well under 1 in 1,000 patients that would happen with. Bleeding, abnormal bleeding, is also another complication that we think about. But again, it's equally rare, well under 1 in 1,000. That's even when we are removing polyps. So overall, we consider colonoscopy to be quite safe. And for that reason, we consider it the gold standard for colon cancer screening, right? It's a very effective, but also safe and available tool.
All right, so we've gone through a bunch of true and false things. What do you think the final takeaway message that you want folks to hear about this?
Yeah. I really appreciate you allowing me this time to talk about this, because it's a really important topic. Colon cancer, again, is unfortunately very common in the United States, but it is preventable and it is treatable when we find it early. And colonoscopy allows us to find these colon cancers early, or find these polyps before they have a chance to morph into colon cancer, and remove them and thereby reduce the risk of progression to colon cancer. But patients are still worried about colonoscopy, and I get that. And I would encourage a couple of things. One would be scheduling an appointment to talk about these options for screening, because at the end of the day, the best screening study is just simply the one that gets done. So again, if you're concerned about colon cancer, or certainly if you're concerned that you're having symptoms that might suggest colon cancer, then I absolutely urge you to schedule an appointment and talk about this. It is a very important topic.
And are there just a few symptoms that you can pass along so that people would know, oh, I didn't even know that was a symptom?
Yeah, so blood in the stool is one that is certainly highly concerning to patients when they see it, and certainly want to get that evaluated. Change in stool, where it would be like thin or ribbon-like stools. abdominal pain that tends to persist, or any of these symptoms that we're talking about that just aren't going away. Some of the other big ones we talk about are unexplained weight loss, or maybe even night sweats. Again, would be a reason to say, hey, let's go in and get an appointment and talk about your options of screening.
This is one of those ones where you don't want to put it off. I know in the last 2 years we've been putting off lots of preventative things, and so this is definitely one that we want you to do. This is one that Julie Luck wants you to do as well, for sure. All right, let's take a look. If you have missed any of this, all this information is going to be in the To Your Well-Being section, so that you can go back and listen for these questions and also get resources as well.